Thank you to the Heart and Stroke Students Association for their kind invitation. My name is Padma Kaul. I'm a professor of medicine in the Division of Cardiology. I'm also the co-director of the Canadian Vigor Centre, an academic research organization, in the Department of Medicine and the Faculty of Medicine and Dentistry at the University of Alberta. I hold the Canadian Institute of Health Research Sex and Gender Science Chair and the Heart and Stroke Foundation Chair in Cardiovascular Research. But that is just my day job. My full-time job involves looking after my two daughters and my very large dog. The picture of the girls is a little old. They are now teenagers and taller than me. Most of the research that I do can be categorized into three buckets. I spend a lot of time working with data, looking at the epidemiology of heart disease. For example, I look at how many people in Alberta have heart disease. This is called prevalence. And how many new patients develop the disease every year, called the incidence. I examine whether the trends in the prevalence and incidence are changing over time and whether they are different in men versus women or in specific ethnic groups such as South Asians or Chinese or Caucasians, whether they are different in older patients versus younger patients or in patients from lower socioeconomic stratum. I also look at the extent to which geography affects heart disease, for example, comparing rates of heart disease across the Canadian provinces and across countries around the world. I also do cardiovascular health services research. This involves looking at how patients with heart disease are managed, how often they present to the emergency department, how often they are hospitalized, what kind of treatments they receive, what drugs they are prescribed, and how much these healthcare services cost the healthcare system. And perhaps most importantly, I look at the outcomes of heart disease. A major focus of my research is to try and identify risk factors for worsening disease or death among patients with heart disease. This includes developing statistical models to predict who is at high risk for these bad outcomes. Increasingly, my team is using new methods, such as artificial intelligence, machine learning models, to identify patients who are at high risk. So why do I find cardiovascular health research exciting? Well, because heart disease is the second leading cause of death in Canada. In 2017 alone, it accounted for almost 30,000 deaths among men and in over 24,000 deaths in women. I hope that my research can contribute in some small way to our understanding of who is at risk of heart disease, how they are treated, and identify potential ways to improve their outcomes. I'm particularly glad to be talking to you in the month of February, which has been declared Heart Month to raise awareness about the risk of heart disease. Over the last decade or so, there has been a major focus on increasing awareness among women. Education campaigns such as Go Red for Women by the American Heart Association or the Canadian Her Heart Matters have done a great deal to inform women about the risk of heart disease. Historically, heart disease was thought of as a man's disease, and most of the research on heart disease has been based on male patients. But heart disease is the leading cause of premature death in women in Canada. Although if you survey women, they probably think it is breast cancer. Heart disease is more likely to be missed in women than in men. Part of the reason for this may be because women present with different types of symptoms compared to men. They also tend to delay calling emergency medical services or getting to the hospital, resulting in longer times between when their symptoms started and when they receive appropriate therapies. My current research is focused on identifying women who are at a higher risk of developing heart disease at an earlier time point so that they can be better informed about their risk and can be encouraged to make behavioral changes, such as improve their diet, do more exercise, to not smoke, in order to reduce the risk of heart disease. The pregnancy can offer a window into the future of the cardiovascular health of both the mother and the child. It is a natural stress test, and women who have complications during pregnancy, such as high blood pressure, diabetes during pregnancy, or babies born prematurely, may be at a higher risk of developing heart disease. I have developed a longitudinal pregnancy birth cohort in Alberta to study chronic disease development in the mother and child. Diabetes is an established risk factor for the development of heart disease. While early detection and treatment of diabetes is crucial for both men and women, it is particularly key in women, as it has been suggested that the presence of diabetes negates the female advantage with respect to cardiovascular outcomes. Over the next few years, my research team and I will be working on examining diabetes and its implications on heart disease in men and women in Alberta. These are just a couple of very large number of research projects my team and I are working on at present. There is no dearth of questions still to be answered and evidence to be generated. The University of Alberta is home to several world leaders in cardiovascular research, and I would encourage those of you who are interested in pursuing a career in this area to get in touch with them. In addition to my colleagues at the University of Alberta, I would like to acknowledge funding agencies, including CIHR and Heart and Stroke Foundation of Canada, and agencies such as Alberta Health, Alberta Health Services, and the Alberta Sport Support Unit that have provided the data for my research. Thank you for your attention, and please feel free to contact me if I can answer any additional questions. Thank you.